Your dental surgery experience starts at midnight the night before. Please pick up and put away any source of food that your cat may find, although they can have water. At your assigned surgery drop-off time, you'll bring your cat to the lobby, fill out some brief forms, and speak to a technician. Your cat is then brought to our treatment area while you continue your day. In the treatment area, the veterinarian performs a pre-surgical exam. We listen to the heart, lungs, feel the belly, check their weight, and of course we examine their teeth. Your cat will also have an ECG or an electrocardiogram, which is sent to a cardiologist for review. Your veterinarian uses these results to help catch any previously undiagnosed heart conditions and to tailor the pre-anesthetic medications used during surgery. Your veterinarian then calculates the pre-anesthetic drug doses, the IV fluid rate, and the emergency drugs that could be potentially needed during the procedure. Once the pre-anesthetic drugs are ready to be given, your cat has a team of dedicated technicians at their side. The medication takes about 10 to 15 minutes to make your cat very sleepy or groggy. During that time, your cat is in the dentistry suite kennels and the technicians are entering the fluid delivery rate into the fluid pump, prepping the IV catheter materials, and ensuring the warm water circulating pad is the right temperature to keep your cat comfortable during surgery. The dental x-ray machine has your cat's information entered. The anesthesia monitoring machine is prepped for use. The technicians are watching your cat get sleepier throughout this time. Once your cat is sedated, the technicians place an IV catheter for fluid and medication administration. They pass a breathing tube or tracheal tube for oxygen and gas anesthesia, as well as to protect the airway from water and saliva during the dental surgery. One technician scales, polishes, and x-rays your cat's teeth, while the other technician monitors the anesthesia. Anesthesia monitoring involves physically watching your cat and noting breathing rate and depth, listening to their heart with a stethoscope, controlling the depth of anesthesia using isoflurane gas and oxygen, as well as reading the anesthesia monitor and interpreting the results. The monitor tracks heart rate and rhythm with a continuous ECG, just like what your cat had before surgery. It also tracks carbon dioxide output, oxygen levels in the blood, respiratory rate, temperature, and blood pressure. The data is recorded by the anesthesia technician every 5 minutes to help track any changes and prevent problems from developing. Once the technician is finished cleaning, polishing, and x-raying your cat's teeth, the veterinarian assesses the x-rays and charts the teeth with the assistance of a technician. Charting the teeth helps keep track of changes over time, as the chart is part of the medical record. If any teeth are diseased and need to be extracted, if any masses are found, or if any infections are present, the veterinarian is ready to assess the situation and address the problem. If extractions are needed, the veterinarian will administer a local anesthetic to numb or freeze the nerve. This keeps your cat comfortable both under anesthesia and after they are awake. Your cat will also receive an injection to minimize post-operative pain, in addition to the pain medication in the pre-anesthetic already given. We want your cat to be comfortable at all times. Once surgery is completed, the anesthetic gas is turned off and your cat remains just on oxygen supplementation. The anesthesia technician helps your cat to wake up slowly and smoothly while continuing to monitor their heart rate, blood pressure, and temperature. Your cat is groggy and unsteady at first, so the anesthesia technician transfers them back to the surgery kennel to keep a close watch while they clean up the surgery area. Once your cat is awake enough to be transferred to the treatment area, the anesthesia technician will continue to monitor your cat's temperature until they are awake enough to go home. We will call you once the surgery is completed and set up a discharge time. When you return to the hospital to pick up your cat, you will receive a written discharge detailing today's procedure and an illustration showing the position of any teeth extracted. The discharge will discuss what medications were used for your cat's comfort, what medications you'll give at home, and how to feed your cat during the next 2 weeks. We will also schedule your 2-week follow-up before you leave. At the follow-up visit, your veterinarian will examine your cat's mouth to ensure it's properly healed from surgery and address any potential complications such as infection.